right. Good morning, good morning, good morning. Thank you for joining us and giving us your time. Today, Lupus Ascending, in collaboration with our wonderful guests, are going to take you through understanding alopecia with lupus. So I have here Dr. Cindy Muliro, who's a consultant dermatovenerologist. If I got that wrong, you'll help clear that up. Thank you. At Mama Lucy Kibaki Hospital, she has a clinic, Derma Health by Dr. Cindy, and she's the National Coordinator, Global Psoriasis Atlas, Kenya. And also, we have Dr. Eric Moimi, who is a clinical dermatovenerologist, Wajir County Referral Hospital, and they're here to take us through this what do you call this, situation that can develop when you're a lupus warrior, and something that both lupus warriors and supporters are keen to understand and learn more about, and see how to, at the end of this, how we can manage and cope with this situation. So, welcome. Thank you so much. We would like you to introduce yourselves. Tell us why you became dermatovenerologists. I apologize for mangling that. But so open the floor for Dr. Cindy and then Dr. Eric.
Good morning, everyone. Thank you, Eric, for the introduction. I'm honored to be here this morning to talk about alopecia and lupus. As mentioned, I am a consultant dermatovenerologist. You said it right. Essentially a dermatologist and venerologist. Dermatology, where we cover the skin, hair, nails, and mucous membranes. And venerologist to stand for sexually transmitted infections. So that is my area of interest. I got into dermatology because I have dealt with dermatological issues myself. It was a personal drive or a personal motive. I had essentially good skin throughout my life until I got pregnant, and then I developed very severe acne, and this led me to try and research more about skin, find out more about skin, and the mechanism and science in regards to the skin. And at that point, I also fell in love with skin, and that's why I decided to pursue my interest in dermatology and venerology. And I also know and understand the psychodermatological aspect that dermatological diseases tend to have. And I know lupus is definitely not an exception. So hoping that we will learn from each other and build each other from this talk. And yeah, that's all I can say for now.
Thank you so much, Dr. Cindy. And it's a wonderful motivation, and thank you for sharing that story with us. Dr. Eric, take us through your law, as the kids say.
Yes. Hello, everyone, and good morning. Yeah, as you said, my name is Eric Muemi. I am a clinical dermatovenerologist, currently based at Wajir County, offering services at Wajir County Referral Hospital. My interest in dermatology came quite early in life. Before even I joined the medical fraternity, I used to do some skin works, some nail paintings at a cheap salon there near our home. Later now I joined clinical medicine, whereby now thereafter I did the higher diploma in the dermatovenerologist. Now I also identify now the gap in the health sector. There was that gap of managing clinical skin conditions, whereby people are just giving prescribing antifungals, even if not the real skin issues, not the fungal infection. So I decided now, yeah, I need to learn more about the skin conditions and also the nails and hair, so they can be able to help. And also in this field, there's the it's lucrative because you can also make money doing the same. Out there, people need a real dermatologist, and also people take care of their nails and hair. And now here I am, and I also now thank you for giving us this opportunity to learn from each other and also support each other in this endeavor now. Yeah. For now, there we are now. Thank you.
You're very welcome. Thank you so much. Yes. Oh, we appreciate it. So now what we'll do first is we'll allow Dr. Cindy to go into a presentation to just take us through the how how it operates, how it works, an overview of lupus, how it affects hair in both young and adult warriors, and common symptoms and early warning signs. Then from there, we'll go into a small question session that we have from two of our community members, Rita and Doreen, who asked very good questions about lupus and everything that happens around it and what people do to try and manage their condition. So and then after that session is done, we can finish up with a short presentation from Dr. Eric, taking us through management strategies and treatment options, medications, and also when to seek professional help in that sense. So we've shaken it up a little bit compared to our previous sessions, but no worries, it'll be good. Thank you so much. All right, Dr. Cindy, will you share your screen, your presentation, or I do that on your behalf? Oh, okay, no worries. Okay, take us through.
I hope you can hear me.
I can hear you very clearly. Thank you.
Perfect. All right. So good morning again. I'll briefly take you through understanding alopecia with lupus. And our focus is more on the alopecia end of the spectrum than on the main lupus, but tying it together with lupus. So the objectives of this talk today, or at the end of this talk today, I am hoping that we will have a little bit of an understanding of lupus, how alopecia occurs in lupus, and how we can be able to identify early signs of lupus. Lupus is a chronic autoimmune disease where the immune system attacks its healthy tissues. You have the affected individuals producing autoantibodies and immune complexes that mediate tissue damage. Now, these autoantibodies and immune complexes come about when on a normal day or on a normal working immune system, when the body detects a foreign object or a foreign invasion, it produces antibodies that fight this invasion. Now, in the case of lupus, the body sees an antibody, fights it, but after the fighting of this antibody, it leaves like signals or reminders to the body that we have fought such a thing before. So when something else happens that is not necessarily the same condition or the same trigger, the autoantibodies that are already in the system tend to be triggered or reactivated and then attack now the normal cells that were essentially not foreign before. We tend to see lupus a lot in women, and we say that it affects up to 90% of women. And the most common age is at 15 to 45 years old. And amongst lupus warriors, 85% suffer from hair loss. Lupus essentially affects all systems of the body. No system remains spared. And of course, the skin being the largest organ is largely affected, where the skin in itself is affected, the hair is affected. You have sometimes nail involvement, and you definitely have oral mucosal involvement. Now, there are very many types of lupus. I'll just talk about these four major ones. You have the systemic lupus erythematosus, which is the most common one, the SLE. Then you have discoid lupus erythematosus, the cutaneous lupus, and the drug-induced lupus. In the systemic lupus erythematosus, or SLE, usually affects the skin, the joints, your organs like the kidneys, brains, heart, and lungs. And as mentioned before, this is the most common type of lupus. It also, since it affects the skin directly, it definitely has an effect on hair loss. And systemic lupus erythematosus is mostly associated with hair loss that involves diffuse hair thinning. On the other hand, we have the discoid lupus erythematosus, which causes a skin rash with inflammation, a lot of reddening, and also scarring, and mostly happens on the face, the ears, and the scalp. and sometimes on other parts of the body. We also have the cutaneous lupus erythematosus, and this causes sores or wounds on the areas of the skin that are exposed to the sun. We know the scalp most of the time is exposed to the sun. And then we also have drug-induced lupus. This is lupus that is secondary to, say, a drug that you were exposed to, and then your body confused it for a foreign invasion, and then decided to fight it. So the most common types associated with hair loss are the SLE, as mentioned, and the cutaneous lupus erythematosus. The cutaneous lupus erythematosus is more associated with the scarring hair loss. That is the permanent type of hair loss. And while the SLE is more associated with the non-scarring type. However, they can go both ways. So just a little bit about hair or the hair cycle. Um, in a normal hair cycle, you have essentially three main phases. That is the anagen phase, the catagen phase, and the telogen phase. And we essentially go through these phases. Of note is in human beings, we don't essentially go through these phases at once. Like all the hairs don't go through the same kind of phase. Each hair follicle independently goes through its own hair cycle. So when you're checking through your scalp or your head, you'll find that some hairs are in the anagen phase, others are in the catagen phase, while others are in the telogen phase. Now, the importance of knowing these phases is the active phase of hair growth is essentially your first phase, which is the anagen phase. And this essentially occurs in the hair follicle. This is where there is activity. This is where you have the stem cells. This is where you have essentially hair growth signals. And when we have a lupus inflammation, this is where it happens in the hair follicle. Whatever comes out of the skin or out into the surface is quote unquote dead hair, as referred to here. So we want to get the process while it is still here in the anagen phase or in the hair follicle, while the inflammation is still early on. However, we of course sometimes miss all this and the hair goes all the way up to the telogen phase. But you realize when you have an inflammation or an infection or any other trigger, some of these phases can be skipped or can be rushed before their time. That is why you end up having hair breakage, you have hair thinning, and you also have your hair falling out. Now, hair loss in lupus particularly occurs due to very many mechanisms, but there are some factors that are largely associated with hair loss in lupus. First and foremost is the lupus flare-ups. As mentioned before, the active disease triggers widespread infection, and the infection is not spared to just the skin or the organs. It goes all the way up to the hair follicles. And if you remember the previous image, right there at the hair follicles and where the stem cells are is where this inflammation occurs, and when it occurs, it leads to the various types of alopecia. And then we also have the discoid lupus. It is a specific type of lupus that causes red scaly plaques on the scalp that leads to permanent hair loss if untreated. Then we also have hair loss due to medication, and some medication that warriors might be on, including immunosuppressants and corticosteroids, can cause hair thinning and sometimes hair shedding. This is just to say the hair loss in lupus is not just a one or unidirectional cause. The causes could be many. It could be the disease itself, or it could be the medication used to treat the disease. Or on the other hand, it could also be due to nutritional deficiencies. We know that in lupus, there tends to be low levels of iron and vitamin D. And you find that even when we are treating patients with these conditions, we tend to supplement the iron, we tend to supplement vitamin D. And these contribute a lot to hair health. And these levels being low means that we won't have hair that is healthy. The reason this happens is when you have an active inflammation going on, your body or your brain sends signals for the body to focus on quote unquote the most important or the vital organs. And at that point, the body does not read a hair follicle as a vital organ. So it spares activity sort of on that area to focus on fighting in other areas. So you find that the hair follicle is deprived of these essential nutrients. That's why now you end up having this abnormal kind of hair growth. Then, of course, with stress and fatigue, especially when it's common, and we know that conditions like lupus really take a toll on you psychologically. And this particular type of hair loss associated with stress and fatigue is called telogen effluvium. Effluvium essentially just means pulling out of hair, yeah, which is also a temporary condition. Now, just a little bit more specific on what I've just talked about. As I mentioned, specifically for hair loss, one, it is an autoimmune attack on the hair follicle, the specific hair follicles. And then this inflammation eventually, if not treated or addressed, leads to a scarring form of alopecia. At the same time, also because of the chronic and repeated flare-ups, we also tend to have vascular changes in the scalp and around the hair follicles. This also affects hair growth and hair texture and the outcome of alopecia. And then, as mentioned again, medications can also trigger hair loss. So, in summary, just say it's because of hair follicle damage which leads to reduced hair growth and excessive hair shedding. That essentially sums up to alopecia. Now we go to some specific forms. I decided to classify it in terms of scarring and scarring instead of the specific alopecia types because this is what affects more commonly. And the non-scarring type of hair loss is reversible. And as mentioned, it is the most common form of lupus-related hair thinning. And this hair often improves with proper treatment and disease control. Remember, we said it is reversible. Here in this case, as you can see on this bottom left photo, the hair becomes very brittle, very fragile. It's very, very thin. As you can see, this patch is quite thin as compared to, say, this patch on this other end. It becomes very thin and leads to increased shedding across the scalp. So this can give an impression of bald patches around the head. And these patches may grow or regrow with treatment. The next kind is scarring alopecia. The scarring type of alopecia is more of the permanent type of hair loss. If we catch it while the inflammation is still happening, when it is still red, as you can see here, a red ring, we can try and save the hair around here. However, if we don't catch it in time, the inflammation tends to cause scarring around the hair follicle. And like if you see here, if there's scarring, there's no potential for hair to continue growing from that point. Usually you see a lot of redness, a lot of inflammation, and it's quite scaly. And as mentioned, the lesions end up with scarring, and you'll see smooth, like here on the left, the areas tend to be very smooth and bald, and the hair does not grow back completely. Then the other type that I had mentioned before is the medication-induced hair loss. And medications like immunosuppressants, immunomodulators, corticosteroids, and the likes can affect the hair growth cycle. And it can lead to temporary hair loss. And usually the patients will tell you that when they comb their hair, sometimes they get a chunk of hair stuck on the combs. It's easy for the hair to be pulled out. There's even a test that we do called a plug test or a pull-up test, where you're able to just pull out hair from the scalp and it easily comes out. Now, the good thing about the medication-induced hair loss, usually the hair loss stops as soon as the medication is changed or discontinued or adjusted. So we are usually not very worried about this type of hair loss because we know the hair will definitely come back. One thing I should mention, there is a specific type of hair called lupus hair. It's essentially just a description of the kind of hair that lupus warriors can have. You can think of it as small or short, fragile hairs along the frontal hairline. Some people can describe it as somebody who's taken a pair of scissors and just cut it across that part. You might feel like this part is haphazardly cut and this part of the hair continues to grow. That is a typical manifestation of lupus hair. Here is a scar from a previous lupus flare up or a lupus activity. And here, this is an inactive patch. And this patch also, as you can see, has no hair. There is no hair follicle. So here, unfortunately, there can't be any more hair growth. But if this patient had come earlier, probably would have caught it at the inflammation stage and would have prevented the scarring from occurring. Across age groups and genders, we find that alopecia and lupus tends to affect people similarly or differently, if I may say. Among children and young teenagers, this alopecia is usually the early sign. So when you see a child presenting with bald patches, don't just always treat for, the go-to is to treat for tinea, for mashilingi, as people say, for tinea capitis, or eczema, or seborrheic dermatitis, those types of things. But we need to be very alert. We need to be very aware that it is one of the first signs of lupus amongst children and teenagers. And because of this, especially in the psychosocial setup, the children tend to experience a lot of bullying and they tend to suffer from low self-esteem. And that is why it is important to include psychological care in Lupus Warriors. We can't just give medication, and not look at the psychological impact that it is bearing on an individual. Amongst adults, the alopecia tends to be related to the disease duration and the medication that one is taking. And yes, just as in children, it has a very high emotional impact. And as I said before, stress is one of the triggers of alopecia in lupus. And continued disease means continued stress, and continued stress means worsening of the disease and the alopecia. As mentioned, more than 90% of these patients are women. And again, this is also, it has created a major psychological toll amongst the population. And not to say that men are not affected, they are also very, very affected. And the psychological impact cuts across, I believe, across all age groups, across all genders. So just to create awareness and things like that, we need to also include psychological care in lupus warriors. Some of the things to look out for or early warning signs. Generally, lupus, as mentioned, affects very many systems, if not all of the body. And some symptoms, like on that figure, include hair loss. You can get recurrent fevers that you can explain. You have constantly fatigued. You have stiff or swollen joints. You have a rash where in areas of sun exposure, that is your face, your hands, your feet, your scalp. You have Raynaud's phenomenon syndrome. This is where if you put your fingers in cold water, they turn blue. Um, you have your oral sores and your mouth sores, and then constant headaches. These are signs that should be triggering somebody to not just assume it's a regular downtime. It's important to be seen by a doctor and have a proper assessment and diagnosis. Now, when it comes specifically to hair, if you notice you have sudden hair shedding, if you have what I described as lupus hair, where the frontal hairline seems to be chopped off by a scissor or seems to be woolly, if you have scalp redness or scaling or sores, these are wounds on the scalp, uh, please run and see a doctor. And if you also have rapidly developing bald spots, it's important to just not take them for granted, have them checked out so that we can assess and let you know how you're doing. I believe that's the end of my part. Thank you.
Thank you very much, Dr. Cindy. That was very illuminating. Yeah, so the it's quite a complex process, the way this whole thing happens, and the psychological impact clearly is big, especially with children. And I guess I wanted to ask whether, or something that can come up later on, is whether there's support groups for people who are like quite young or kids, although would that even work? But anyway, let's put a pin in that. Right now, what I'd like to do is go into the questions that we received from our two community members, Rita and Doreen. Yes. So, Dr. Cindy and Dr. Eric, we have a question here from Rita where she asks, my first question is to know, she actually says hi fam bam, but anyway, my first question is to know how Lupus Warriors deal with alopecia in terms of treatment, and if they are relying on natural methods such as the use of Ayurvedic herbs such as rosemary and fenugreek, rice, onion water, and essential oils, etc. to deal with alopecia. Secondly, how best can we support Lupus Warriors to deal with alopecia? Thank you. So we'll tackle that first, then go to Doreen's.
I believe Eric is going to also cover a bit of management. However, I can talk about just a tip I usually give my patients. Have a tab of a corticosteroid, a high potent corticosteroid. Start with like a mometasone or clobetasol. Have it in your cabinet. When you notice, that is if you already have a diagnosis of lupus, and you notice that you have that patch, apply that corticosteroid. It might be the move that stops it from being scarring, so stops it from turning to a scarring type of alopecia. Yeah. When it comes to the home remedies, honestly, I do not have any data in regards to it. No studies have been done in regards to that I can point out and say that this works or this does not work. But I can think of it in terms of some of these things might work in the form of the body assuming their triggers, and sort of like the immune system, quote unquote, gets confused and works on that, thinking it is a better option or that. But I cannot confidently tell you, yes, use rosemary, use this, unless Eric has some more information that I don't. Thank you.
Yes, hi guys. You are doing fine. Thank you, Doc, for that wonderful presentation so far. Uh, Now, Edwards, you are going to present the slides for me, because now you are going to do a bit treatment. Also, I'll be answering some of those questions which have been raised.
That's okay. I can do that for you.
All
All
right.
right.
Thank you.
All right. So should we go into the presentation first, then we come back to this, or we can go
Yes,
to
yes.
Doreen's questions?
No, first we go to the presentations.
Okay.
Then if they won't get the answers there, now we can revisit them.
All right. No problem. Okay.
Okay, yes, there we are. Now Doc has covered most of the slides there. So we are going up to the slide number 17. For now treatment, we are going to start there. Yes, there now we are. The telogen effluvium.
Okay.
There.
All right.
Yes, yes. Yeah, yes, now as we have heard, there are two major types of alopecia which occurs in lupus and even on other population, mostly the non-scarring and scarring alopecia. So yeah, first we're going to tackle the non-scarring, whereby doc we've heard it has said there's the telogen effluvium, which simply means that the patients with systemic lupus may develop this condition. The telogen itself means the name given to the stage of the cycle where the hair follicle is resting and then shading off sometimes. Effluvium is now the losing. So normally our hair grows daily by 0.3 to 0.4 millimeters, and about 90% of the scalp hairs are in anagen and only 10% are in telogen at any one moment. As we said, they are not synchronous, so that you cannot have a complete shading of the hairs. We go to the next one. So telogen effluvium is a common cause of diffuse hair loss that usually presents with acute or chronic loss of hair due to an abrupt shift of numerous hair follicles in anagen to telogen phase. If the percentage of hair follicles in the telogen phase increases significantly, then there will be an increase in hair shedding and diffuse thinning of the scalp, and all body hair will develop loss. Yeah. Next. So this now ideal picture of the telogen effluvium. You can see there's that diffuse hair loss at the scalp. Mhm. Next. So remember that you've said there are also other causes for the same. So all these nutritional deficiencies, hormonal imbalances, like pregnancy, childbirth, fever, acute blood loss, drugs, if you've had also hypothyroidism or hypothyroidism, also extreme physical and emotional stress. All these now can lead to telogen effluvium also, apart from the lupus now. Next. So here now, when we come to now to diagnosis, because now for you us to manage the hair loss properly, first you need to make a clear diagnosis of what you are dealing with. So for you to make a clear diagnosis, you have to take a good history now from the clients when they present to you. And now for us, for the audience, it's also good to know what is happening to your hair. So you have to be able to describe the duration or which the hair loss began and the duration, the progression of the hair. Was it transient or was it just acute onsetly? Or it's something or even congenital. Sometimes we have those congenital disorders, and then we need to describe the location, or if it's a pattern. With some hair loss, they have a pattern way. You can say some they are focal, others it's more of a pattern. They fuse some. So you need to at least to be able to understand how you experiencing your hair loss. Then you also need to know the extent of the hair loss. And it's also good to know that in a normal person, there's that normal daily hair loss shedding, which is a normal thing happening daily. We've said there's that the cycles of hair growth. There's that cycle of shedding off. So it's normal to gain some few like 50 to 100 hairs per day. It's normal shedding those ones. Then you need to tell us how are you taking care of your hair at home. Maybe you may be shampooing so frequently, and you see some of those shampoos are harsh. They can cause also some hair to fall off. And also, it's good now to be taking some photographs so that you can see how your hair loss has progressed. You can able now to say like the 2 months ago my hair was like this, and now you see the difference. Yes. And also now we need to know are there other associated symptoms. Like for example, is there other pain? Is there itchiness? Is there burning sensation? For us now to try to make the diagnosis, now these symptoms will help to rule out other causes of diffuse hair losses, non-scarring, of course. Yes. Then you need to tell us, is your hair a loss? Are they breaking? How are they the whole the hair? Does it has that small white bulb at the bottom, the proximal end? You see now that's you can say this is a telogen hair. But when that white, I don't know whether you get that white bulb at the end of hair. If it's absent, it's meaning this is a broken hair. So this is not a telogen hair. You need to know that also. I need to note that as a audience so that you can tell your doctor. Another thing is now the hair care practices. If you said sometimes there's like for I mean braiding hairs, and then prolonged traction, braid all ponytails. So also they can lead to a form of hair loss we call traction alopecia. And then the other thing I was saying is about the patterns. You see, like for females, there's not. How do you make sure it's not a hormonal by making sure their menses are okay. There's no sense of fertilization. Yes, and also we go to the drugs. If you say their drugs can cause also hair loss, and also diet. It's good to know what kind of diet someone is taking. I've been on, and then any other significant illness. Is there a major surgery which has been done? If you said any has someone gone a childbirth, or all those thyroidism disorders, you all need to be able to check them out. Then there's also the on the physical examination. You need that's now it's for us doctors. We examine your scalp. Of course, we examine the scalp and the rest of the skin because remember there are also other sides of the body containing hair. It's also good to look at them. It's not just focus on the scalp alone. So you might find your doctor saying, "Let me examine your whole body, everywhere you have hair." They might be able to check or you report whether there is another place of your body with hair loss. So of course now here at the slide, you can see the instead of making diagnosis of unscarred alopecia, we have this test which we call hair pull test. Doc have talked about it, whereby this one you can even do at your home, well seated there. You just pull gently, like 20 to 50 years. You run your fingers over from the base up to the top. Then normally there's 1 or 2 year shaft are dislodged, which is normal one. But if now they are more than 6 or to 10, meaning now there is uh, yellow telogen now effluvium setting. Now we also need to know blood tests to rule out how those other possible causes of the hair loss. Like we've said, the thyroid stimulating hormones, that is thyroid function tests. We do them. We see your complete blood counts. We see your iron levels, ferritin, and then there's those other knee serological tests like for the syphilis. You see, also syphilis can cause hair loss. So we need to make sure it's not there also. Let's go to the next slide. Mhm. Okay, so now for the non-scarring alopecia, here now we are going to the treatment. Recovery and return to normal hair density is a very slow and can also take many months. So we also tell our clients it's not a one-day thing like if you are treating malaria. That's what I normally tell guys do. Because now someone will take medication for like 2 days and then comes back. Oh, that will funny kazi. So I'm like, no, it's very hard to get. So let's wait and be patient and continue using the drugs. Yeah. So as you say now in lupus, we have to detect early and then early initiation of systemic drugs. That's how where now we can arrest further hair loss. Because you said in unscarring is easy to manage, but we don't want to go to the unscarring other one. And then for the subacute cutaneous lupus can cause inflammation leading to that unscarring alopecia, as we have been saying. Higher. We can go to the next one slide. Here now we go to the scarring alopecia. We normally call it in our cicatricial alopecia. So now this is the worst type of hair loss. Now mostly it's brought by because of patient with discoid lupus erythematosus may develop now this cicatricial alopecia, which is an inflammatory disorder of the scalp that lead to permanent hair loss. And it involves the destruction of the hair follicles and loss of follicular hostia. This is simply the, 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 the where the hair now comes out of the skin. The patient presents with well-demarcated inflammatory leg that develop atrophic scars, like the one you've seen. There's also a picture there down there. Let's go to the next slide. You see now, like this one is now classical discoid lupus erythematosus. You can see now, at this stage now you cannot reverse. The hair is a bit gone. Now you have to go to other mechanisms of now of treatment. Yes, next slide. So there are also other causes of cicatricial alopecia. If we said they can be congenital, like developmental, hereditary, like plasticutis. You can also get them from trauma and also post-radiation infections such as herpes zoster, tinea capitis. All these can cause scarring alopecia. You also have folliculitis decalciferans, dissecting. So these all these diagnoses they are made by the doctor. That's why we are saying when you present, you need to be able to explain your symptoms clearly, and then the doctor examines. So now they can make a diagnosis because each of these we can they are managed differently. Yes, next slide. Okay, yes, nini picture of tinea capitis. You can see those mushling there. The hair is gone completely. Even the other one, the guy lupus, the motor 2 meters, is a form of other disco lupus. Next. So yeah, for treatment or for the unscarring. So for us to be able to manage this condition properly after making now the correct diagnosis, we need also to consider all the other impacts of the condition. Like for example, we said warriors with this discord, the chronic one, there's that psychological emotional impact. Someone feels their self-image, they lack confidence, they have that self-esteem goes down. So we need to identify those challenges early and then cancel on time. Then for the emotional stress, they start a feeling of sadness, frustration, embarrassment, anxiety. So sometimes even gets them to have a social withdrawal because of the for the for the for the hair loss. So we need to there's also stigma and misunderstanding, because some other people will be looking at you and like your hair is, you have lost your hair, they can see scars and they don't know what's happening now. They tend to ask questions, and you start leading someone to isolate from even social functions because of the low self-esteem and the self-image. So of course, for us to be able to cope with such psychological impacts, we need to, like for this group of the lupus warriors here, is a nice way of coping, whereby we have a community understanding each other. We can share our concerns and now advise each other on how we get along with the community. Of course, there are so many other ways you can do. Like you can see when you get these lesions early, before they become they lose their ostia, you can initiate these topical treatments like topical corticosteroids, betamethasone, mometasone. You apply them maybe like twice per day, and they will try to reverse the hair loss before it reaches the non-scarring stages. You can also use the topical tacrolimus inhibitors. You see, also these drugs, they also have side effects, so you cannot use corticosteroids for so long continuously. So you can interchange them. And also, when you have some small patches, you can use the intralesional corticosteroids also. You inject these steroids direct to the scalp, and they can stimulate hair to grow. And for some, you can excise the patches and gloss. Yes. And now, when you come, we get this permanent scarring whereby these above measures are not applicable. Now we have to find a way of living. We can use now the cosmetic camouflage, like creative hair styling. You can alter the color of the hair. You can get wigs which are fitting with your skin color, and also your hair where the hair has gone. Yeah, depending with the degree and the type of the alopecia. So we also have now, we can say the best way, the best measures which someone can do. We are going to see them there down there. Yes, next slide, though. Oh yes, now we are taking the systemic drugs. Of course, when once in the for non-scarring alopecia, the early initiation of hydroxychloroquine. These are very nice drug for the lupus warriors, because now it tries to control, it minimizes the immune complex which are destroying now the hair follicles. At least the hair now can someone can be assured when they are using the hydroxychloroquine in a nice way, their hair will be safe. And then the other drugs also, methotrexate and other immunosuppressants. But also remember, we said these drugs others also cause the hair loss. So it's now for the doctor and the individual client to be able now to see which is the best drug they can use at particular moment, and then which drugs they are on. Is the hair loss due to the drugs? Is it due to other causes as we have seen, or what could be leading to the hair loss? Very important to make the diagnosis correctly. Next slide. So here now it's what you can do at a personal level. At a personal level, I always tell my clients, we need to avoid ultraviolet exposure. This now you have to limit sun exposure, especially between 11 a.m. and 2 p.m. when the sun is very hot. You can stay indoors, and then we can be wearing these. I recommend these white brim hats, and we make sure they are not allowing sunlight to penetrate through. So you make sure you hold up, you look at the sunlight to ensure that the weave is sufficient to block the transmission of the light. Yes, and also now you can wear the recommended dark clothing with long sleeved and tight weaves. These are all ways of protecting from the sun exposure. The hats, the long sleeved shirts, and avoiding the daytime sun. Next slide. Yeah, here we have examples of the hats which I am saying. You see the white brim. They have to be like these white brim hats. They protect the sun exposure to those exposed skin. And then you wear your clothing, or long sleeved, continue helping to protect the sun. Next. So the other thing is now the broad spectrum sunscreens, creams with sun protective factor more than 30 plus. You need to get one for yourself, containing the physical blockers, titanium dioxide to block the entire UV and the visible light spectrum. Yes, then they are applied either in the morning to all the exposed sites after application of topical corticosteroid. So first you have to apply your medication if you are currently using it, the corticosteroids. Then you apply the sunscreen on top of it after some few minutes. And then now remember you need to reapply. You keep reapplying the sunscreen. For example, if you are having your leisure time and then you are swimming, maybe after some few hours you can reapply your sunscreen. Mhm. Next slide. Yeah, also now the use of LED bulb for the indoors. You see the other bulbs they are also have the UV, so they are you avoid them. You change the indoor light bulbs to the LED ones, and then you also we avoid the light used for nail curing. You see, for ladies they like the manicures and those pedicures we used to do many years ago. So you avoid those lights they are used to for curing the cutex. Yeah. Then of course we need to avoid cigarette smoking because tobacco, yeah, it interferes with the hydroxychloroquine metabolism. Thus they say it's hard to control hair loss in smokers. Then of course now we said if already you are on systemic drugs, never miss your dose, because drugs don't work in people who don't take them. So we know there's always that pill burden all the time you are taking drugs, and sometimes that pill burden, and now someone says they can stop. No, don't quit. You don't stop early. You continue taking the drugs, all the time, daily. Even if you set your alarm, I know most of us now they know how to do it. Yeah. Then there's also now the supplements. After if you did the after the investigations of blood and you find out you have the low vitamin D's. Also remember you are protecting from the sunscreen, the sun exposure. It also sun also provides the vitamin D. So it's always good to check the levels of the vitamin D, and also now iron. After you realize your iron levels are down, there's always you can improve, you can boost by diet, of course, and other iron supplements. Then, of course, we have the minoxidil. Minoxidil is a drug used for hair stimulation regrowth. It stimulates the hair regrowth. 5% it can be in a form all solution. But remember, you cannot use minoxidil when the lupus is active. First, you need to make sure you don't have active lesions on the scalp before you apply the before you apply the minoxidil. Meanwhile, you can be using the topical corticosteroids and your systemic drugs. Next slide. Yeah, we said that there earlier. It will not always be lupus. It can be other hair loss caused by other factors. You see, medication. We've said we have all these other diagnoses. You can central centrifugal scapular alopecia, tractional alopecia, androgenetic alopecia. All this now and fungal is now our job now to make the right diagnosis. We have to get a very good history. Of course, someone with lupus can also have all these other conditions. So whereby you need to make the right diagnosis for the right treatment. Very important. Mhm. Next, here are more clips of the same. You can see the central centrifugal scatter alopecia. We have that diffuse hair loss at the scalp, at the panels, and then there is another one, the left side, the traction alopecia. We've talked about it there, traction alopecia. Next slide. This, here you have other diagnosis which lead into the same alopecia areata. They are the same, but now you have to make the right diagnosis because treatment differs with each diagnosis. There is a certain point where there is a alteration of now the management. So you need to get the first to make sure you get the right diagnosis so that you can be able now to treat clearly. The next one. Oh yes, who to see now? Yes, if you see now, it's always good to know when to see your doctor. Here you have your dermatologist, Dr. Cindy is there. Here I am. You can visit us anytime if you feel there's a need. And also you can see the rheumatologist because now, and if you have to see a rheumatologist, make sure now you also involve your dermatologist because they need to be able to communicate whatever they are using in the other side, so the other doctor can also be aware of what is happening. And also now the beauticians. Remember we've talked about the hair wigs, the weaves, the braidings, the traction alopecia. Because now when you keep on uh, putting on these tight braids, now they lead to the traction alopecia. So you need to go to your trichologist who understands these other conditions. They'll be able now to help so that you can be able to conquer the lupus. Being aware that the hair loss in lupus is not just about the scalp. It touches also the heart and mind, yes, and even the identity. So healing must therefore be medical, emotional, and also social. You should be able to integrate all those so that you can have the best outcome. And some also to add on the best scalp practices, we need to behave all the time to make sure our hair, mostly the scalp, is all well moisturized. We need to use natural oils to make the scalp moist. Because with dry scalp, now there comes itchiness, and now the hair now begins falling off because of scratching. Then now there was a certain question which we were talking about the natural remedies, the Ayurvedic herbs, rosemary oil. There's that story which they say rosemary oil stimulates circulations and hair growth, more so in the non-scarring alopecia. But as the doc said, we don't have real evidence for these natural remedies. It's just, you see, other guys use rice water, onion juice. They say they can strengthen the hair, and sometimes reduce the chances of breakages. But as you say, there is no strong data or evidence for use of these natural and remedies. But of course, they can soothe the scalp, but they cannot reverse the scarring alopecia. So and remember also, some warriors have sensitive skin, so you might be applying a home remedy, and instead of helping out, it irritates the skin, and it can even trigger more rashes. So remember, the natural remedies may be complement, but should not replace the medical treatment. Of course, now the best support you can do, there's those early dermatological referrals. Whenever you see your warrior, there's someone is worried about the hair loss, it's good to report to your doctor very early. Don't wait until now we get to the scarring time. The earlier the better, because when we initiate treatment early, we can reverse for the non-scarring. So once you come to us, we'll provide, of course, the right education and the safe treatment. Then also we'll encourage you to continue the support groups whereby we encourage each other, offering support, and also normalize the alopecia. And then we have sometimes it's good now to sensitize the even the public. Sometimes you see some guys there, they have those uh, insensitive words. Someone can just tell someone with lupus some insensitive remarks about the hair, and then it triggers more low self-esteem. And of course, from where we work, employers and even school for the kids, sometimes we need to be allowed to wear those sun protective clothing, like for the long sleeved and also the hats. We need to talk to those teachers and even our employers. And of course, the other is now the public awareness campaign. Of course, this now comes to the even the government. We need to make the public aware about these conditions and how to support each other, because we keep on talking about the lupus and then someone is not happy about the same. Yeah. So there I am. Yeah, I've talked a lot. Mm-hmm. I think that's now the end of my the from my side. Thank you so much.
Thank you so much. You've talked enough, not a lot. Yeah.
Okay.
All right, yeah. No worries about that. Thank you so much for the presentation. It was quite illuminating and detailed. Also, thank Dr. Cindy for hers as well. Both very illuminating. And I think we will share these resources once we put this video together into something that you can watch on demand on our YouTube channel. Yeah, so just want to go back to the questions that we had been asked by our community members, Rita and Doreen, of which you've answered in part. And I just wanted to now focus on the ones that probably we've touched on, but maybe you can go deeper. And if it's outside of the scope of expertise, no worries, you can let us know. And that would be the idea of supporting Lupus Warriors, the best way to support them. That is from Rita. And the other one is from Doreen, where she talks about, in a more broader sense, psychological, emotional impacts in Lupus Warriors, both male and female.
Okay. Yeah. For the we say the psychological and emotional impact, right? Yeah.
Yes.
For number one, from the psychological part of it, you see, lupus uh, make someone the self-image and confidence it's a bit challenging, because someone they live with this, the low self-esteem because of their body image. They cannot go about their daily and social work at ease. So due to that emotional stress and feeling of sadness and frustrations, embarrassment and anxiety, sometimes now you see now the audience now tend to have the social withdrawal. Of course, it's a major issue, but now such need to be handled by the psychologist and specialist about the mental health, because it all comes. It is also associated with the depression, and you see with the depression there is the worsening of the existing struggles and symptoms. So, for the psychological and emotional impact, the coping methods now which you can put in place, for one is the support groups. It's happening right now. You try to educate what is happening and offer suggestive ways of living, whereby you can be able now to move around with your daily activities without worrying so much. But also remember, yeah, sometimes one might need a professional approach for the same. Uh, because someone who has they tend to have the social withdrawal and isolation, they might end up overusing chemicals trying to heal themselves, but they end up adding worsening their scalp conditions, whereas they are thinking they are trying to help because of their social pressure. So someone like this it will be wonderful for them to seek professional help from the psychologists and counselors. Uh-huh. Maybe Dr. Sid can add more on that one. Yes, and the other question was about the best support, right?
Yeah, the support. How the lupus supporters or caregivers, as well as or even like partners or friends, in that sense. Once we become well aware that our lupus warrior is dealing with alopecia, how best we can support them.
Yes, now the best way to support our warriors, number one is once we notice maybe someone was having mild hair loss. Nowadays it's increasing. We need to alert them and refer them to professionals. Like now the dermatologist there where now we come in, the early referral system. That's what we can do better for for our warriors. And once now they come to us, we'll educate about the condition first. We need to understand well all about the lupus and the challenges. Then the safe treatment modalities. If you've seen, there are so many ways of treating, and then when you go to those other beauticians, they can do some things worsening the already existing hair loss. So you need to go to a beautician who has a knowledge about the lupus, and also how these styles can affect all aggravate the hair loss. Of course, another way to support is to providing counseling and the mental health services. Of course, they may not be available at the time, but now you can also refer to professionals about the same. And then another thing is now to avoid, of course, those insensitive remarks about the hair. You someone then umwambia we kipara. Sasa you think now they are not happy or about the same. So we try to avoid such insensitive remarks. And then, as you said, another thing was about the now the our social daily lives, maybe schools, work. So whereby our colleagues and schoolmates, they need also to be aware of these conditions so that they don't now continue talking those insensitive remarks. And for the employers, they can allow, and even the schools allow the kids and the employees to adorn these sun protective clothing, because sometimes someone has to wear all the time the long sleeve or the hats all the time, and then you are in class, and then someone the malim is saying, why are you wearing a hat? You see, we need to enlighten them. And also another thing we can do is now to be able to provide these sunscreens and the clothing. Of course, the hats, you see, there's always the money involved all the time. So we need to find a way of making sure these appliances are available. Yes. Yes, Dr. Cindy, you can add more also about that.
Thank you, Eric. I can talk about the support groups and patient support. Um, I remember you had mentioned something about pediatric support groups. What I know is available, we do have patient support groups worldwide, and I know there is an organization that supports patient support groups. However, as highlighted, it's not just about the patient, it is also about the caregivers, and statistics show that the caregivers are as involved as the patients. There is an association also for caregivers where you can get support, and I will try and get the links and share. However, support groups can also be self-formulated. A few people come together. It is better than nothing, in my opinion. Um, Come together, share stories. I believe what also Lupus Ascending is doing is amazing, and creating awareness will go miles into making the quality of life for Lupus Warriors better. Yes, I think that's what I can add.
Oh, thank you so much, Dr. Cindy and Dr. Eric. Those are very good. They are great answers. And then just following up on Dr. Cindy, first of all, thank you for the kind words. We appreciate it. We're working hard on getting that awareness. out there. Would you be talking about Suruvi Care? I think they have like a group that takes care of, like caregivers or brings them together. We've worked with them in the past. Would that be them?
That's not them. There's still another one. There's an umbrella. There's a worldwide umbrella. I'll share it. I'll share it. Allow me to do that. It has just gone off my head.
No worries.
Yeah.
Okay. Okay. All right. So we do have another question that was talking about like positive and negative coping strategies, and I think you've touched on the positive ones. Are there, as far as you know, in terms of what you've interacted or dealt with, whether they are negative coping strategies for lupus warriors who have alopecia? Sorry, I ran out of breath there. With alopecia, yes.
Um, I wouldn't point out a particular coping mechanism that I may have seen. However, what had been mentioned before in terms of the questions, it's more of people trying home remedies. And what I would just advise is just consult a professional before trying anything, especially if you have chronic illness or you're on long-term medication. The best thing to do would be to talk to the professional. A negative coping mechanism that I can think of right at the top of my head is a lot of it is more psychological, the self-pity, the self-destructive sort of behaviors. That's what I think I light as a negative coping mechanism for now. But that is addressed with psychological care. That's why also it's upon us as the healthcare providers to manage the patient holistically, not just for me as a dermatologist, just the dermatological aspect. I have to think about this patient as a whole, the psychological, the rheumatology, and all the other aspects involved.
That's great. That's wonderful. Eric, you have anything to add, or I can go to a couple of more questions outside of that?
Yeah, I think it's well answered. We go next.
So there's a question here. What Doreen was asking is whether the degree of alopecia depends on the type of lupus a warrior has.
Alopecia in general is very individualized. Remember, we said the hair follicles are very independent. So it's not a one size fits all. It's essentially how your own immune mechanism will respond to what it thinks is a threat. That's how I would answer that question.
Thank you very much. I'll go to another question here. I think Dr. Eric touched on it, which is about the minoxidil for hair growth. You mentioned that it should not be used when the lupus is active, and that I guess what would be asking is whether it's becoming like a standard practice in terms of dealing with alopecia in our lupus warriors, and is it effective? Like it continuously like ticks the boxes of this is now therapy beyond the caveat that you shared.
Yes, minoxidil is used. It's good to use minoxidil, more so when it's after it has been prescribed. Yes, because as you said, when the lupus is active, it can worsen the symptoms. But also remember, we've said there's the scarring and scarring. Minoxidil cannot help after we have achieved the scarring alopecia. It can only be used earlier on when we have the non-scarring, especially when we have the telogen effluent. It can now be used to stimulate the hair growth. And now for the minoxidil, it takes quite a while to use. You need to use it for like 6 months for you to be able to say, now I have achieved hair regrowth. It's not a short-term remedy. You need to be able to use it for quite long time. And also, you don't stop the other medications. If you are also using the oral systemic drugs, you continue with them. And now, so on top, you can now add the minoxidil after it has been prescribed. So don't it's not wise to do self prescription for the same. Let your doctor prescribe it for you after making sure now it's safe to use it.
Okay, thank you. Is it expensive, by the way? Just for us to know.
Oh yeah, yeah. It's
Oh,
sometimes quite expensive. It
uh-huh.
depends also with the company and the place where you are buying it from.
Okay.
Yeah, they are quite a variety in the market.
Mm.
So it's from ranges from between 4,000, 6,000 somewhere there.
Okay. All right.
Yes, for like 200 mils.
Ah, okay. And how long does that take the 200 ml? Or
Uh,
the, no.
uh,
Oh.
Maybe of course it will depend with how you are using it. You
Mm,
see,
mm,
without wasting,
mm-hmm.
you can say like three to 4 weeks. You can use that one.
Okay. All right.
Yes. Mm-hmm.
Great. Thank you. I have a question from Khadija. This it still ties in with your profession, dermatologists. It's not exactly tied into the alopecia, but she asks if she says her SLE, sorry, affected her skin and became quite dark. She's on HCQs and azathioprine. Is there anything that she can do to improve the color of the skin?
Um, Hi, Khadija. Thank you for the question. Sorry about that. Um, it is one of the things we see, especially in SLE, the hyperpigmentation. However, when we control the disease, we expect the hyperpigmentation to sort of go away, but it goes away very, very slowly. Now, you can come, have us check you out, and then we can advise on appropriate medication that you can use for pigment correction. But it is because of the internal effect of the disease affecting the melanocytes. So we have to address the disease first, and then we can address the color correction, the pigment correction. Sorry.
Thank you, Dr. Cindy, for that. Um, she can come to your clinic. Is that okay?
Yeah, yeah, that's fine. That's fine.
So okay,
Yeah, you
Khadija,
can share my contacts.
I will do that
All right.
with that. Okay. I think I'll open it up for any question from those who are in attendance. About 30 seconds. See if anyone has anything else they would like to ask. If not, I think I would want to say thank you to our panelists and conclude. But 30 seconds. Prepare your questions.
I have a question for Dr. Eric. Um, in terms of minoxidil, minoxidil, some cases, some people have been showing that they get hair growing on the face, right, and other parts instead of their hair, their scalp. So because I was given minoxidil to use, and that information is there, I've not been I've been hesitant to use it. So which other option can I have besides minoxidil that I was given to use? Thanks.
Hey, Doreen. Yeah, thank you for the question. Yeah, of course, minoxidil, how it functions, it stimulates the hair regrowth. So probably once you apply on your scalp, and now you want to sleep, and then it can drain all the way up to the face. Mostly, it can now stimulate the hair follicles there. You see, even on the face, there are two types of hairs. There's the terminal and the vellus hair, which is soft and cannot be seen from far. So remember now when the minoxidil comes into contact with them, they can reactivate, and now the hair started growing. So that's the reason you can have the hair growth on the face after application of the minoxidil. Yeah, so what you need to do is don't fear applying. You can apply, but make sure you after applying you give it some time to stick on the scalp to dry on before maybe you do other things, so that it cannot drain to the face now and stimulate the hair on the face. And then the other option apart from minoxidil is there are those topical corticosteroids we've said they also stimulate the hair growth. Also, we can have the betamethasone lotion. You can apply, you can apply them betamethasone lotion, or if it's localized, we can do the intralesional injections to stimulate the regrowth of the hair also. Yeah. And then also the other systemic drugs, you keep on using them to reduce the immune complexes, destroying the hair follicles. Yes. Fine. Have I answered you, Doreen?
Thank you. I have another question um, for you and Dr. Cindy as well. In cases of avascular necrosis, can that also affect hair loss? And what can the person do?
Thank you, Doreen. Yes, vascular changes I mentioned in the presentation are part of hair loss or hair loss in lupus. Definitely, when there's change, especially the necrosis, it means that the hair follicle is no longer supplied with blood. Remember, it is an active living part of the skin. So if the blood vessels have been affected, definitely there will be no nutrients being taken there for hair growth. I believe that's the first part. I forget the second part of the question. Remind me.
So in that case, what option can the person take to use?
Okay, so it also depends on the type of lupus that is causing the vascular changes. When you have the necrosis, it means that the vessels are essentially dead or gone. So it means that you will end up having the permanent type of hair loss. However, the body is also very privileged to have a lot of regeneration and angiogenesis properties. So you might be lucky enough for the body to regenerate and you get a fresh supply of blood vessels in that area. But if not, unfortunately, that will just remain to be a permanent type of hair loss. We can give the immunomodulators and the corticosteroids to try and activate or restart the hair growth process, but honestly, it's a bit tricky.
Okay, thank you. Thank you.
Thank you, Doreen, for those questions. Just going back to our panelists, Dr. Eric and Dr. Cindy, the angiogenesis that you talked about, is it something that is spontaneous, or there is also treatment that can help this process?
It's a normal physiological process. So if the say that you have an active flare up, it means that now your body is producing auto antibodies against those blood vessels. Uh, we have to see if it will end up in that necrosis, but we will not wait for it to go to that end. That is where now application of the corticosteroids and the immune modulators that we're giving, like the hydroxychloroquines, the mycophenolate mofetils, they help to stop continued degeneration of the vessels, such that now we can give space to new stem cells to now do the angiogenesis.
Okay, thank you. Thank you very much. Is anyone else who has a question for our esteemed guests? Okay, if not, then what
I
are
have a question.
okay?
Dr. Eric, you mentioned something about washing of the hair, right? Washing the scalp. So my question is, what is the best way then to take care of the scalp in that condition? How often should you wash the scalp, wash the hair?
Oh, okay. That's a nice question, Doreen. Yes, it's always good to wash the scalp with mild shampoos, sulfate-free, non-irritating cleansers. You see, when you now need to make a choice in the market, okay, there are so many shampoos out there, so you need to at least choose which are non-irritating also to your skin. Sometimes you need have to you really have to do some patch testing on your skin to find the best shampoo for yourself, because each of us might have a different body reaction to some shampoos. So it's always good to do a patch testing. You get you apply a little somewhere else before you apply on your whole scalp, and then they have to be mild, non-irritating, and then sulfate free. Yes, then you don't need to do every day. Sometimes you can even do like twice per week shampooing. I think that would be okay. And then after the shampoo, you apply a natural oil. So these virgin oils, like the coconut oil, they are good. The virgin coconut oil, it's good for the skin, and it's a good moisturizer for the scalp. And then, of course, we apply the sun protective mechanism. Don't forget about the sun protection, or even for the scalp. And also now, we avoid the harsh chemicals and styling, and, and braids, of course, because all those they can also contribute to the more of the hair loss. So it's your approach is that a holistic way. You are using a mild shampoo, doing it infrequently, like twice per week, applying the those natural oils, and then of course avoiding the sun and making sure your styles are fine, that they are not aggravating the hair loss. Yes, have I
Then
answered you, Doreen?
I have a question. You mentioned about hair sun protection for the scalp. Um, is it that there are lotions, or I mean, hair lotions that have sun protection, or we just use the normal sun protection on the scalp?
I don't get the word you say in the sulfur,
No,
sulfate,
no, 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 not sulfur. The sun protection,
or
right?
sun protection.
Uh,
Oh yes, yes. For the sun protection now, for the scalp, we are using the hats. Remember the white brim hat, and also the clothing. You see, like the way the hijab and the gabsari. I don't know whether you know those things. Yo,
I do,
they
I do.
yes, they are other way of, you see, clothing by itself protects from the sun rays, the UVA. So you
Mm,
can adjoin
mm,
the those clothing and all the white brim hat. They are the best way of sun protection. You don't
mm,
have a sunscreen for the nini, for the scalp. If it's there, I've not come across it, but maybe Doc can clarify if it's there. The sunscreens for the scalp.
mm. Okay.
Um, we do have some products for hair that have SPF in them, especially the hair mists and some lotions. However, they're honestly not very readily available in Kenya. Some of the brands I have seen that carry it include the Cantu, I think, brands. They do have, I think, a mist with SPF. However, you will not go wrong by applying regular sunscreen also on your scalp. It's okay.
Oh,
Oh,
good.
okay. Okay. Thank you. Thank you.
Thank you so much, Dr. Eric, Dr. Cindy, and Doreen. That was very illuminating, the questions and the answers given. Yeah. And
Oh, wait, the last one, sorry. Um, would it be genetic if a mother has this condition of hair loss on the scalp, but then she gets pregnant? Will the child also have that kind of condition?
It is not automatic that a pregnant mother will give lupus to the child, but yes,
Mm.
there is a genetic role that is involved in lupus. However, it is not like a direct transmission from mother to child.
Okay, okay. Thank you.
thank you. Thank you very much. Yes. Um, I think, if I'm not wrong, I think we've probably covered a good number of questions. If there's anyone who has additional questions, don't worry. You can share it with me. When the video goes up, there'll be a link that I'll share in the community group. If you want to join the community, just let me know, and I'll share the link with you. And questions can be asked there from here on, and we'll try and also get the answers to you in that sense. Okay, so thank you very much, Doreen, for leading the charge in the interactive section with the questions. She's the co-founder as well, the Lupus Warrior, and for our panelists, we really are grateful for your time today and for your expertise and your knowledge. And we would, of course, love to have you on again with regarding any other topic with respect to lupus and the aspects of skin with dealing with this particular journey. So I would like to request that you both just, tell us where we can find you. And thereafter, I'll give my vote of thanks and wish you all a wonderful rest of your weekend.
Okay. You can find me on Mondays and Fridays at Mama Lucy Kibaki Hospital. That is a public hospital in Nairobi. I'm also working at AR Hospital, so mostly on Tuesdays and Fridays. So you can reach out to me there for now.
Yeah, from my side, it has been a wonderful to be with you for that long. Me, I'm found at Wajir County from Monday to Friday. Of course, Wajir is a public hospital. And I'm also found at for those of us who are within Wajir County, African Dermatology Clinic is there around at Wajir town, where you can find me, of course, daily from Monday to Sunday in the afternoon, mostly from 3 p.m. to 6 p.m. Yeah, that's where I'm usually can phone. But now it's wonderful because now you can when you are dermatologist, Dr. CD is there around Nairobi town, so you can always reach us easily. For me, only for us maybe at this county you can find me, but always you can talk via the phone and the forums. Yes. So thank you.
Fantastic. Thank you. Thank you so much. All right. I want to say thank you very much for everyone who was able to join us. So we saw a few people who are moving around about. I hope you get to where you're going safely. Thank you for your time and for your ears, brains as well, because you're absorbing this information. And please feel free to let people know about this particular aspect of what our Lupus Warriors deal with, and that there are people who can help. And then also that we are actively learning to see how we can support our Lupus Warriors and also expand our own knowledge as Lupus supporters. So thank you very much, Dr. Eric. Thank you very much, Dr. Cindy. Thank you, Doreen. Thank you, Rita, Khadija, Andrew, Beatrice, and we say have a wonderful weekend, and let us enjoy this wonderful day of rest, if anyone is resting anyway, as well as Sunday. Okay, I can now say have a wonderful day and kwaherini. Asante sana.
Thank you.